Murmur is actually an abnormal sound. We have different type of murmur like systolic murmur and diastolic murmur. In systolic murmur, we have three different categories like ejection or mid-systolic murmur, pansystolic murmur, and late systolic murmur. Ejection systolic murmur occur in the following conditions: aortic stenosis, pulmonary stenosis, atrial septal defect, hypertrophic cardiomyopathy, and tetralogy of pellets. Now the position where these murmur is best heard for aortic stenosis: aortic area, second intercostal space right to the sternum; pulmonary stenosis, left sternal border; for ASD, left sternal border; for HOCM, left sternal border; and for tetralogy of palate, left sternal border. Now pansystolic murmur. These murmur are produced throughout systole. Pansystolic murmur occur in the following condition: mitral regurgitation, tricuspid regurgitation, and ventricular septal defects. Now position where these murmur is best heard for mitral regurgitation: apex of the heart; for tricuspid and ventricular septal defect, left sternal border is best position where murmur is best heard. Late systolic murmur. Late systolic murmur occur in the late phase of systole and occur in the following condition: hypertrophic cardiomyopathy, mitral valve prolapse, and coarctation of aorta.